Hello everyone, myself Salesh Liajumali. I am a second year MBBS student. Today we are going to discuss about topic drugs affecting coagulation. These are the subheading that we are going to cover under this topic. Fibrinolytic drugs. The drugs are streptokinase, urokinase, reticulase, altiplase, tenecteplase. Then now, what is fibrinolysis? The process of dissolution of clot is called as fibrinolysis. Fibrinolytic drugs can help to dissolve clot and restore blood flow to affected areas. They are also known as thrombolytics. They work by activating the fibrinolytic system. Now we will see how the fibrinolytic system works. In response to stimuli, tissue plasminogen activator is released from vascular endothelium. It binds to fibrin-bound plasminogen and converts it to plasmin, which degrades fibrin. These drugs that lyse thrombi rapidly by promoting conversion of plasminogen to plasmin. Plasmin degrades fibrin and rapidly dissolves the blood clot. These are the pharmacological properties of this drug. The streptokinase is a protein derived from beta hemolytic streptococci. It binds with circulating plasminogen to form complex that activates plasminogen to plasmin. They are antigenic, pyrogenic, and destroyed by circulating antibodies. These therapies are less expensive. Urokinase. It is an enzyme obtained from human fetal kidney cell culture. They directly activates plasminogen to plasmin. They are non-antigenic, non-pyrogenic. Altiplase. It is a derived from recombinant DNA technology. They are selectively activates plasminogen bound to fibrin. They are non-antigenic, non-pyrogenic, and they are not destroyed by antibodies. They are rapid acting and more potent. This therapy is expensive. The T-half of streptokinase is 30 to 80 minutes, and for urokinase it's 10 to 15 minutes, whereas in altiplase it is 4 to 8 minutes. The streptokinase is administered by IV infusion. Urokinase it administered initially has IV bolus and followed by IV infusion. Altiplase is also initially administered as IV bolus and then followed by IV infusion. The adverse effects of streptokinase are bleeding, hypotension, allergy reaction like fever, chills, skin rashes, and rarely reactions. The adverse effects of urokinase are bleeding, and the hypotension and allergic reaction are rare. The adverse effect of altiplase have the lower risk of bleeding and allergic reaction. The uses of fibrinolytic drugs, they are used in acute myocardial infarction, deep vein thrombosis, pulmonary embolism, ischemic stroke, peripheral arterial occlusion. In acute myocardial infarction, this drug lyses the clot, help to decrease the infarct size, improve left ventricular function, and decrease mortality. Most effective if administered within 1 hour of onset of symptoms. Deep vein thrombosis. In deep vein thrombosis, there is thrombus formation in the deep vein, especially in the legs. The patient presents with pain, swelling, discoloration of skin of the affected leg. Thrombolytic therapy helps to provide symptom relief, improve lymph perfusion, and prevent pulmonary embolism. In pulmonary embolism, DVT can lead to pulmonary embolism. This patient develops sudden shortness of breath, chest discomfort, dizziness, rapid pulse and breathing, etc. Fibrinolytics are used to lyse the clot, improve pulmonary perfusion and right ventricular function. In ischemic stroke, the altiplase is useful provided it is administered early and there is no intracranial hemorrhage. The contraindication of these drugs were recent trauma, surgery, abortion, stroke, severe hypertension, severe diabetes, severe liver damage, peptic ulcer, and bleeding disorder. Now, the antifibrinolytics. Antifibrinolytics block the conversion of plasminogen to plasmin and inhibit the fibrinolytics activity. The drugs are epsilon amino caproic acid and the tranexamic acid. The epsilon amino caproic acid is administered orally or intravenously. It is used mainly to control bleeding due to overdose of fibrinolytics. So it is one of the antidote. Thrombolysis can occur. In tranexamic acid, it is more potent than epsilon amino caproic acid. It is available for oral, IV, and topical administration. It is used to control excessive bleeding due to overdose, following dental extraction in hemophiliacs, menorrhagia, etc. Its side effects are nausea, vomiting, diarrhea, headache, etc. Antiplatelet drugs. The drugs that inhibit platelet aggregation are called antiplatelet drugs. The classification of these drugs are given below. They are classified into COX inhibitor, that is aspirin, urinogenic receptor blocker, they are irreversible, reversible, glycoprotein inhibitors, they are monoclonal antibodies, synthetic molecules, and the phosphodiesterase inhibitor, that is dipyridamole, chilostiazole. The mechanism of platelet aggregation and inhibitor are also given here, in which the cyclic AMP, when it decreases, it promotes addition of platelets, while its increase in cyclic AMP inhibit addition of platelets and release of 5-HT and ADP. The glycoprotein receptor antagonist. Activation of this receptor favors binding of fibrinogen to this receptor, resulting in platelets aggregation. The efzimfotide and tirofiban blocks receptor on platelet surface to inhibit final step of platelet aggregation. It is a monoclonal antibody that binds to glycoprotein receptor. It is a synthetic drug which is more specific for glycoprotein receptor. It is a non-peptide receptor antagonist. They are useful as adjunctive therapy in high-risk patients with acute coronary syndrome undergoing PCI. The main side effects are bleeding, thrombocytopenia. Phosphodiesterase inhibitor. Dipyridamole is a vasodilator. It inhibits phosphodiesterase and increases the concentration of cyclic ADP, AMP level with inhibit platelet aggregation. It is occasionally used in the combination with warfarin during post-operative period in patients with prostatic heart valve. The uses of antiplatelets agent are: they are used in transient ischemic attack, coronary artery disease, myocardial infarction, cardiac valve replacement, coronary angioplasty, peripheral arterial disease, and ischemic stroke. Now the questions are: first, the preferred route of administration of streptokinase in acute myocardial infarction is, and the options are A. Intracoronary, B. Intracardiac, C. Intravenous, and D. Intramuscular. The right option is intravenous. Second, which of the following drug is a glycoprotein 2B3 antagonist? Options are A. Aspirin, B. Clopidogrel, C. Efzimfotide, D. Dipyridamole. And the correct answer is C. Efzimfotide. Third, the following all drugs are fibrinolytic except, and the mnemonic for what is SURAT, the streptokinase, urokinase, tranexamic acid, and altipase. So the correct answer is C. Tranexamic acid. 4. All of the following antiplatelet drugs are ADP antagonist except A. Aspirin, B. Tiaclopidine, C. Clopidogrel, D. Dipyridamole. And the correct answer is A. Aspirin. 5th, streptokinase overdose is treated with A. Warfarin, B. ACA, C. Aspirin, D. Vitamin K. The correct answer is B. ACA.